we're one seat short from Michelle.
Yep.
Can we get Michelle a seat? Thank you. It's nice, isn't it? Great, no, that's fine. Yeah, thank you.
Thank you so much for coming this evening. I'm just going to do a little bit of housekeeping. My name's Annette McTavish and I'm the director here at the museum. The main thing really to say is thank you so much for coming. This panel discussion begins for us a week of reflection for Mental Health Awareness Week, but it's also our first event in our third week of activities that have been happening as part of I Was, I Am, I Will Be. And this was an idea that came to us through Portheden to look at, I suppose, what is a museum's responsibility, but looking at the past. And we started to look at our collection in a different way. And then we were joined in the project by two other fantastic partners, Quiet Connections and Joining Dots. And through that we've got a programme of activities. So this evening, I'm not going to talk for too long, but we're going to have a really interesting panel discussion, and really generously chaired by Lon Shriek from BBC Radio Cornwall, and we're just delighted to have everybody here. In terms of practicalities, there's tea and coffee at the back, there's toilets at the back here, and we're also not expecting a fire this evening. We're not going on plan, so the fire alarm does go off. There's staff around who've all got badges, and we'll make sure you get safely out the building, and we gather at the cannon at the front. So I'm just going to hand over now to the panel and to Lawrence, and just thank you so much for coming this evening.
Panic not, I have got a microphone. Hannah's got a microphone, and at some stage, if you fancy talking to us at any time after tonight's debate, would be great, and then we can broadcast that on BBC Radio Cornwall. I've never chaired such a celebrity sort of panel, or such a large celebrity panel, some of which I know very well, some not quite so well. For those of you who don't know me, I'm the nice one on the radio. I don't expect everyone would agree with that. I heard of NFU on the left-hand side. I have a particular interest in mental health. I mean, I have a sister with learning difficulties who, when she was 3, had paratyphoid. That affected her life, so her prognosis in life isn't as good as perhaps mine could have been, so but for the grace of God. And for the last 8 years, we've hosted over 100 mental health programs once a month, so we've learnt a lot more now than we certainly did 8 years ago, and we're delighted to get heavily involved in, debates ranging from all mental health problems, and Dr. Ellen Wilkinson has made it all possible in the Cornwall Foundation Partnership Trust. So I'm delighted to be here. We hope it's going to be quite lively. Any question, I've got a couple of questions already, 2 or 3 questions, but at any stage put your hand up and we can just hear from you. That's what we're here to do. And as I said, some of tonight's discussion will be broadcast later in the week, I think. And Hannah will be, from time to time, my producer, taking a few pictures. So if you don't want your picture taken at all, just say that, and we won't put you in any embarrassing situation. So you can get involved as much or as little as you possibly can.
Yeah, is there anyone? I guess. Yeah, just let me know. I won't be zooming in taking place.
No. All right. So let's crack on. There are these celebrity panels. I'm going to start to my left-hand side. One lady I do know very well, Dr. Ellen Wilkinson. So, just in a sentence, Ellen, describe your expertise, if you could.
I'm a consultant psychiatrist, and I originally worked with adults of working age. Still do some clinical work, but my main job for the last 13 years has been as medical director of the Specialist Mental Health Trust.
Fantastic. Dale Allerton-Baldwin, you're a PC, but you specialise in mental health.
Yeah, my job title is I'm Neighbourhood Beat Manager for Cornwall Partnership Trust. My role is part financed by the Mental Health Trust, so I essentially work in the area when policing and mental health overlap.
Fantastic. to your left-hand side, Patrick Aubrey-Fletcher from the NFU. Patrick, you're based in Liscard, I think.
My office is in Liscard. I spend most of my time in my car, which can be quite stressful. But so I work for the National Farmers Union. There are 4,800 farming businesses in Cornwall, and I do my best to represent food and farming within the county. And as we were talking about outside, that can be quite stressful, but no doubt we'll come on to that.
Absolutely. And of course, you drive around, so you're listening to Radio Cornwall most of the time.
All the time, Lawrence.
We'll be asking you questions later. So tonight, really, David Chaisty, this is your brainchild, really. Can you explain your role at Portheden?
I'm founder and director. It's a social enterprise, and we describe it as mental health harm reduction. So we'll do what works to make things better.
To your right-hand side, Dr. Whitney Curry. I knew I was going to get that wrong. Curry, not Curie. I normally say the curry hunt. It should be the Curie hunt. But you're a curry, not a Curie. It's not being recorded. So tell me your line of expertise, if you may.
I'm a public health practitioner and researcher for the Wellbeing and Public Health Directorate for Cornwall Council. And my area is around emotional health and mental health for children and families, and that can range all the way from promotion and prevention all the way to looking at things like what happens after suicide and responses for that.
To your right-hand side, a man we hear of very often on BBC Radio Cornwall. Now I believe a MBE, I know I get it wrong. On the list it said OBE, so get it right. So anyway, so it's not a CBE, it's an MBE. I was trying to elevate it. Don Gardiner, now the work you've done is just absolutely fantastic. Explain to our listeners, I'm sure our viewers here, our people in the audience, exactly how you sprung to fame.
Yeah, unfortunately, I run the biggest food bank in England, in Camborne, and Redruth. We're supplying somewhere in the region of 16,000 meals a month to those people that are struggling with finances, debt, benefits, etc. And health comes into it in a big way because we get people in that are actually struggling with their mental capability because every week is really hard for them. And we've got 4 food banks. We also supply food to lunch clubs, breakfast clubs, daycare centres, drop-in centres, trying to stop food that should be going to landfill and to be used.
Fantastic. And a late entry to our panel, the lovely Michelle West. You're a nurse and you have used mental health service, and thank you for coming in.
Yes, yeah, I've a nurse been working here in Cornwall for the last 20 years and have suffered with varying levels of different levels of mental health problems particularly over the last 7 years, and in the last couple of years it has been particularly difficult, and I've accessed various services and I'm currently under the care of the mental health team.
Thank you. Right, those are our panel, and as I said, we've got a couple of questions I'll be reading out, and clearly, because we have so many panellists, we better not go on too long to answer each of the questions, otherwise we'll never get any other questions done. But my first question tonight, and these are questions that have been posed from people here in the audience, but we can take a lot more, the question is stress ever a good thing? How do we help people to tell the difference between good and bad stress? Ellen Wilkinson.
I guess by the time people get to see me, their stress has usually become bad stress. So something has happened in their life and they've started to develop symptoms that they recognise as being a mental illness or a mental disorder. Whilst I know that in theory there is such a thing as good stress, and stress can improve your performance if you think about it in terms of maybe a sport or something you're really concentrating on, actually being under stress can improve your performance. Your performance will increase, and then it'll get to a tipping point where you start to find it's getting in the way. It might stop you from being effective. It might affect your memory, your concentration, and too much stress and not enough sort of recovery from stress in between, in some people, can lead to their mental health breaking down completely, perhaps going on to get other symptoms, depression, trauma, and you know, to be eventually to be in a situation where you might need to see me in a clinic.
Patrick, we keep hearing the stress that farmers are under. You speak to farmers every day.
Absolutely.
You meet farmers every day.
Mm.
We know the male suicide rates in Cornwall amongst the 20 to 60-year-olds is the highest in the country, and some of those will clearly be farmers.
Absolutely. I mean, sadly, as an industry and with associated supporters, there's a death through suicide once a week in England, in the UK. So it is a stressful business. I mean, why that is, I think, is not straightforward. But some of it is around isolation. So farming has always been very much dependent on things like the weather and so on and so forth. That still exists, and that can create problems. I think the problem is that we've lost that cohesion of a rural community, and therefore farmers are feeling much more isolated. There are fewer people on farm, and therefore there isn't that communication that goes on. When you have a break, you probably sit in your tractor cab on this infernal machine that we all use all the time, and that can create its own stresses. So I think it's more, as an industry, it's more isolation, working on your own, and then when pressures come in, you're not sharing them.
How do you relieve that stress then? I mean, if you've got a farmer who's isolated in a cab, doesn't see a soul for possibly days on end.
Well, not quite that extreme, but yes, I mean, he could be certainly for hours on end during the day. Certainly, we encourage our members to ensure that they talk to colleagues, and we have things like WhatsApp groups, so the phone can be both good and bad, depending on how it's used.
So
and
social media plays a big part.
I can do, yeah.
Detrimentally as well as...
Well, I think both ways. So, you know, one of the other current stresses, but hopefully things will move on, is within all the debate around the environment and the future of our climate. Farming does seem to be taking a improportionate gain or responsibility for that, and farmers take that very personally because they're just really there to try and run a business to feed the nation, and yet there's a very vocal small group who are holding farmers responsible for some of the problems that as a wider society we have.
We know the pressures facing the police. We've heard all too often from the Police and Crime Commissioner, Alison Hernandez, and Sean Sawyer, that you need more money. I'm not going to get political with you, but clearly fewer bobbies on the beat, more pressure on the police. I mean, you've got pressure, you have stress, and you obviously meet people on the street who sometimes you have to detain because they are stressful.
So the job itself has always been stressful, but as you've alluded to there, as budgets have gone down and numbers have gone down, you've got the same officers dealing with the same quantity of work, and the stresses caused by dealing with the incident, but also the stresses of not being able always to do as much as you once did, and having to walk away to run to another job. Within the organisation, what we do look at, and then alluded to this already, is this good stress and bad stress is the point at which it becomes bad. We, the police, I think individually, we're really poor at identifying that. And very often it'll be the straw that breaks the camel's back. Officers will deal with some incidents, and it'll be like water off a duck's back. But it'll be the next incident, and then the next incident. And there comes a time when some really real hardy, tough-looking officers just break. And there's been no obvious sign that it was coming. So nationally, the police are looking at this with regards to how to better assist officers who are dealing with these experiences. But equally, we're dealing with the public who have these very same problems themselves. And as officers, are we good at identifying it ourselves? Increasingly, mental health training is coming into policing to push towards this kind of thing, the motivation to commit an offence or something of that nature, whether it be drug abuse, alcohol abuse, things of that nature, so that we better understand it.
But it's good stress as well. Part of the question was, you know, how do you define the difference between good and bad? I mean, you do need a certain degree of, I suppose, stress to get the best from your staff. I don't know.
No, I agree. You go to a dynamic incident, and that will keep you on your toes. And very often you need exactly that. Because officers face some pretty challenging situations, and absolutely it's a good thing. There's the accumulation of it over a period of time, which can be detrimental.
Michelle, I suppose you know better than probably anyone in this room how stress can affect you as an individual.
Absolutely. And I would say the nurses and doctors in the NHS are in a very similar position to the police, in that there are less staff available to carry on providing the same service, and it's about the recovery time in between. It's the recovery time in between those incidents coming back down, and it does just have that cumulative effect. And you see more and more staff suffering from stress and depression.
Can I mean, as you said, you've used the mental health team. Was that stress related? Was it some? It was stress through work.
Combination of work and personal life, but work was definitely a big significant part in what led to my mental health difficulties.
Don Gardiner, I suppose you see it. I mean, I suppose those people coming to you for these effectively free meal parcels, they must be at their wits' end to actually make that decision to actually knock on your door and walk through it.
Oh yeah, I've seen people actually got a voucher, will stand outside the Foodbank and walk up and down because they're scared to come in, because they don't know what they're going to face. And we just want to show that we care. Just example, a mum, 3 children, came in and asked for food that she didn't need to cook. Now that's alarm bells to me. Why didn't she need it to cook? Is there something wrong with her cooker? No, she had 7p left on her meter and she wanted food. You know, that's terrific stress. Fortunately, we run a food bank and we sent her back home with £49.
A fuel bank as well, not just a food bank.
No, we run a fuel bank as well.
Okay.
So you just saw her face lift when suddenly she realised that we were there not only to support her with a bag of food, but we could support her with some money to put onto her meter. And we see this day in, day out.
The question is stress ever a good thing? How do you define sort of good and bad stress? David, this was your baby really, this whole discussion tonight, looking at how mental health can help people in Cornwall.
Yeah, good and bad stress. I get very philosophical about it. If I meet people who've spent decades in mental health systems or prisons or, you know, in all of the above that we've heard of, and they talk about a life of stress. Is it stress or is it frustration? Is it this constant inability, or not necessarily inability, but this constant something that's not being resolved? Is that what it is? I don't know. Is that quest, that inquiry for trying to find illumination, is that worthwhile? I don't know. Is the life lived worthwhile? Is the problems that are being sought to be resolved worthwhile? I would like to think yes to all of the above. So is there good stress and is there bad stress? Obviously some stress can be very, very painful and can lead to us wanting to die. There's a whole debate about assisted suicides that we should maybe engage in and maybe embrace. I'm not saying that we should legitimate that for everybody, but it's just one of those things that what is good stress, what is bad stress? I think we need to be context sensitive and we need to hear as much from the person as possible and try and understand all the problems that are being faced and try together to come up with a nuanced, sophisticated understanding and resolution.
Whitney, I mean, you're a doctor. Is there enough help out there in Cornwall?
Ooh, that's I feel like I'm about to step in that one. I would say there is a lot of help out there, but I would say that it's not always easy to know where that help comes from.
Not well signposted?
I think sometimes you have to know what you're looking for, or it passes you by. So when I'm thinking about the question about whether there's good or bad stress, I actually don't think of it as good or bad. I think of it as what's normal and what's not normal for people. And I think we're really, really not good at understanding in ourselves when something isn't quite right or normal anymore. As PC Dell said, some of these big tough guys are dealing with things day in and day out until eventually they crack. Whereas, if we were better in tune with what was normal for us, what's our optimal level of stress, because as Ellen said, we can perform really well under a certain amount. If we don't quite understand what that optimal level for us is, we can hit that tipping point and hit it hard and not realize that we might have been needing to look for help at some point, or asking, or just talking to a friend and saying, you know what, something's going on with me and it's just not right today. So for me, it's not necessarily good and bad, but it's normal and when I need to seek some extra help.
Okay, Eleanor, we talked about signposting there, so how can signposting be improved? So you're in charge, effectively, you're the lady, the buck stops with you, doesn't it really?
Thanks.
Well, you run the mental health service.
Yes.
I'm sorry about the sunlight coming into your eyes, by the way. Enjoy it, because it won't be here tomorrow.
So the service I run is a specialist mental health service, and it is it's really for where a number of other things have usually been tried by the time somebody reaches us. So we're providing a service for people with kind of major mental illness, significant mental health conditions. The majority of mental health care is provided in the community, and some of that will be by GPs and people who work in primary care, Outlook South West, the sort of counselling organisation that's commissioned by the NHS, and then a whole range of fabulous organisations that are delivering all sorts of different supportive help and treatments, and I can't even sort of start to list them all because there are so many. We're probably quite easy to find in some ways. There's a website, there's a phone number, there's a GP will signpost to us, but actually there's a lot of services and a lot of voluntary organisations and other resources that are really quite hard for an individual to find. So that sort of directory of services, a lot of it's by word of mouth. People will talk to friends or mention something, but of course not everybody wants to talk about their mental health. So the kind of there's that response of kind of, yeah, fine, I'm fine. How often do you say, hi, how are you? I'm fine. Everything's fine. And so it's not always possible for people to make that connection with other people that might help them.
Sure. That's why at the station, Radio Cornwall, we've been sort of, for the last 8-9 years, holding these mental health phones, if nothing else, just to try to rid mental health from that stigma that's attached to it. Are there any questions? Just let's put the hands up and throw a few questions. Sir, at the end.
Hi. My name's Gary Hayden. I just wanted...
Do sit, Gary. You're fine.
Please, Gary, thank you. My question is about the continuity within the NHS. When you move from county to start with, in that records don't follow you. And then yet even within the county, from GP to GP, it doesn't follow you. And then you find out this GP is using that particular system, and another one's using another system. So every time you're going somewhere, you're starting from the beginning again. And then, yes, okay, well, you must go to that team. You go to that team, now, literally repeating everything that has taken already 18 months in Manchester to get to.
So it's continuity of care. You're looking for continuity of care and the records being held.
Yeah.
And access to them.
And then having to go back, and then even within an organisation where you're repeating the same thing to different people because they need to understand your problem. And they asked me, if you ever feel suicidal, and to be honest with you, my answer to that was yes, with this whole system.
Okay.
But no, in all sincerity, that's a major problem, in that there is no continuity with people's records going from, why should I have to repeat everything that was in Manchester?
I can see several people nodding. Thank you for sitting down as well. That's down to you again,
Probably
isn't it?
is me. I'll take that.
Yeah.
So yes, I know that between general practices it can take a long time to share records, and between different providers, even providers that are quite close together, so NHS providers. We do have a single electronic record now within mental health in Cornwall, and that helps. But one of the things that's difficult is that sometimes you do have to ask the same questions again, and it's not the information you're after, it's actually the story. And there's something about the way that somebody tells the story, or some new information that you might get from the story. So it might seem a bit incompetent, but actually sometimes there's a reason for it.
But very frustrating. I mean, here's a man that admitted that he was at his lowest ebb, he doesn't want to repeat himself
No.
every
I think-
darn person that he
I think
sees.
there's two situations. There's one where the information just hasn't got exchanged, the
Yeah.
information hasn't come through, and somebody's being asked something again that's quite like a fact, something that's not going to change. I mean, we're obviously looking at kind of past, present and future here in the sort of title. The future is looking better in terms of records being shared and sort of more sort of better IT to get that stuff through. But there are things that do change, and so it might be that somebody who's very distressed may actually get asked every day, and they might even get asked more than once a day how they're feeling in relation to their own safety. And that's really a check to see whether something's changed since the last time they were asked. And we perhaps need to explain that a little bit better why we're doing that, but that we do need to do that sometimes.
And Michelle, I can see you nodding in agreement. to that.
Yeah, and I've approached services, I've self-referred into services, the same service, 8 months apart from each other, and had two very, very different responses. And I found that really hard. That was a really very difficult experience for the first time to be given very minimal support, put on a 5-week course, attend this for 2 hours, this will help you, which felt a bit like a tick box affair. I've been put through the system and I was okay, and it made really no impact. And then repeating that, say 7-8 months later, and having a very, very different response from them, which almost was to the other extreme. And I couldn't work out how I could tell the same story twice and have such a different response. And it's left me questioning it. And it made me doubt the services and whether I felt safe in them.
Whitney?
I come at these things from a children and young people's perspective, and also working a lot with parents and carers. And one of the things that we're doing to actually tackle this very thing, because what I get feedback from young people all the time is, I don't want to keep telling my story to every single person I run into, from social care to health to education. And we've developed with young people is what we're calling this health passport. So actually all the electronic records and everything, the health records stay the same, and they follow you however they follow you, but they have their own. They've got their own document, their own account of what's going on for them. Here's what they have said. This is what they've gone over with their healthcare provider for whatever services they've accessed, and they control it and they can take it with them. So actually what I tell adults, if they're having a similar experience, is write all of those things down, take it with you. You might have to go through it with people again, but at least it's there. You don't have to sit there and think, oh, I can't remember what I said last time, I don't know what it is. It's there with you. And I think from a young people's perspective, we've gotten a lot of really good feedback, and they felt, A, they had a bit of control over what felt like was happening to them, getting churned through the system, as I think you said. So they felt like they had a bit of control, and they didn't have to keep repeating the same things all the time. They could hand their own document, their own story over, and discuss it with them, rather than just feeling like it was a tick box exercise. Yeah.
Thank you. And if you are confused, just write to Ellen Wilkinson. Wilkinson. You've met her now, just send her an email.
The question of being asked repeat questions, yes, I understand that they do need to get a sense of who you are, what you are, etc. But it's more the general records that just don't seem to follow you. The general story doesn't follow you. And even moving from one GP to another GP within 10 miles. It's a massive, to get records transferred, different systems. It's just a lack of IT.
I'll leave that in your ball.
It's coming.
It's coming.
It's painfully slow,
Yeah.
but it's coming.
Sorry, yes.
No, there is something, and we've done this, and for pennies from China, we've got NFC tags. We call them tap and tell, and it goes onto our website. Everybody that signs up as a member, it's free membership for anybody, unless you're a corporate, in which case we'll try and get some money off you. Want Peter to pay Paul. But we give these away, and they are quite simply a method by which you can tap a smartphone or any other NFC reader. These things have been used for decades, well, almost a decade now. Up in London, if you've got an Oyster card, that's exactly what it is, tap and tell. This has got it on there. This is Edge 7. or now up to age 10. And it's a simple disc, you tap that, it goes to a website that you choose, and it's got your details on. Simple. There you go. So there's another offer, forgive me.
No, that's excellent, well done. We are in this wonderful, it's the first time I've been in this museum, and it's free to come in, by the way. Are you all from Helston? No one from Helston? A couple from Helston. I thought I'd give you a shout out. Don't worry. What a lovely place, and it's free as well. So where roughly are you all from? Anyone from North Cornwall? Don't blame you, I used to live there. Are you all mid and west Cornwall? Are you all this sort of area? Portheden. We won't hold it against you. But seriously, if you come in here, this place is great and it's free and you can spend hours in here. There's not many free things to do in Cornwall. So, another question from our invited guests tonight. How do we deal with social anxiety in the workplace from a policeman's perspective then? We've touched on this already with stress. So the question is, how do we deal with social anxiety in the workplace?
Social anxiety in what way?
I don't know, I'm only reading the question. Who asked the question? Who wrote the question? Social anxiety. I suppose stress in the workplace. Anxiety, stress, I suppose that's the best way of describing it.
Yeah, social anxiety is really a specific anxiety around social situations.
Right, okay.
I mean, perhaps not so much on that, but in relation to sort of dealing with stress within the workplace, as opposed to social anxiety that you speak of, is something that we all bring with us. As police officers say, with any occupation, we have pressures and stresses around our work, and then we've got our families and our home lives.
How do you balance the two then? Because it must be incredibly difficult, because the nature of your job would mean that at any time you could be buzzed to work an extra 3 or 4 hours, and the work-life balance can be, I'm sure, horrendous.
That's why it's really common. We're due to finish a shift at 10 o'clock at night, there's an incident immediately before it, and you're now on duty for further 4 hours. You know, you're not going to go home and see your children that night. Or, you know, if on a night shift you're working through, well, hold on, who's going to take the children to school? We can't walk away from these incidents. So there are all these pressures and stresses which are added just by the very nature of the organisation that we work for. They could be exactly the same in the NHS, you know, same with the ambulance service, fire service, and public services. Certainly within the police, what they look at is they talk about having this work-life balance. And I think in the very earliest days of me hearing that, I thought there was a lot of rhetoric. But very recently, so I said to the Chief Constable now, it's something that they are looking at. Because if I go sick with stress, you won't see me at work for many, many months. The idea being, let's get in there early, let's see what we can do now, prevent this happening, as opposed to allowing it to happen. Then officers, I know officers who've been on sick for well over 6 months at a time.
But it's still seen as a weakness, isn't it? This is half the trouble. You know, quite happy to go for a few months with a broken arm, but to admit to your colleagues you have a mental health problem, it's still a no-no.
And it's one of the reasons why officers don't seek help early. You know, they may see signs of it. I think one of the more obvious ones is alcohol abuse. They see signs of it, but they don't make the approach because, you know, once the police become aware of this suspected illness, officers are really worried about carrying that label around with them. Will it affect their career? Can they go and do that job in the future, or does it mean that actually the police won't want you anymore? So it's something which they are taking more seriously, and we see stuff within our organisation on a weekly basis around these kind of issues. But I'm not talking about anything which doesn't exist anywhere else. It's the same kind of stuff, whether it be the NHS or whatever.
I suppose in the farming community, equally, Patrick, problems.
I think that's right. I mean, I think farming is a very male environment. And men are not so good at sharing their problems, whether they're physical or mental. So that is something that we see quite a lot of. Having said that, it is changing. So there's much more awareness, both within farming as I think within wider society. So that's something certainly NFU and young farmers are working on a lot. But around recognising symptoms, because I think that's the other thing, is what does trigger. What should we all be doing as part of the community to help individuals who are suffering and help them with that. So that's something that we're certainly looking at. Work-life balance is a really interesting one within farming because there probably isn't any, because it is, you know, in some cases it's 24 hours a day. If you've got livestock, it doesn't really matter. You don't go home at 5 o'clock. You have to keep going. So so tiredness, I think, can probably add to it. At certain times of year, people are working very hard, as I know they are in other industries, but it can bring its own problems.
So, Ellen, how would you define social anxiety then?
It's really around anxiety, stress, the things that people actually would recognise as a feeling of anxiety, but it's particular to social situations. And I think probably it would exist everywhere, in every workplace. It is very common. Very strong association with alcohol as well. It's one of the things that people do
as a crutch,
as a sort of self-medication. And the tricky thing is that to be able to address it in the workplace, there needs to be a conversation, and a conversation between the employee and the employer, or the manager. It needs to be quite an honest conversation about what do you need, because not everybody, that label doesn't mean exactly the same set of problems or the same set of challenges for everybody.
But how many people in this room would admit it? Would I? You have. You're brave. There's people at the front.
Yeah.
You would admit it.
Yeah.
That's great.
And I think I'd be interested in what they say, but I think actually recognising it and acknowledging it means you can start to have those conversations with people who can then make what in the law would be called reasonable adjustments to the workplace.
So you three guys, you're younger in the audience. Why would you admit it then? And in what? Or have you?
It's our job.
Okay.
The exhibition upstairs is about it.
Great. So in what respect?
So we've set up Quiet Connections because we have social anxiety and we really struggled with that and struggled to find any support and understanding, and just felt like nobody would understand, because you look around and you think, oh, it's just talking to someone or answering the phone, and we should be able to do this. And it's the we should be able to do this that stops you from being honest about what's going on for you, and you're nodding. I feel like you get this.
And I've got a son who's got social anxiety. He's only 10. As part of his autism diagnosis, he suffers from terrible social anxiety. And I watch how it limits so much of what he can do, because interacting with human beings, making eye contact, understanding what that facial expression means, getting that humour, close body contact, sitting near people, all of those things he struggles with. So that impairs his ability to be in a group of people comfortably. When he's comfortable, he's as outgoing as anybody else. But as soon as you bring in that social anxiety, he is the child who will hide behind me and who will walk behind me when he's in a place he doesn't know, because he's so intimidated by that environment that he will literally step behind me and stay right behind me with his head down.
And he's 10.
He's 10, and he loses the ability to speak because his social anxiety is so crippling.
So how do you overcome that then?
Well, with him, he's young, and we're working on it, and we're just trying to gently through group. I know about your group, and I think some of that is just experience. Some of it is making it okay. So he's going to a support group at the moment called Redruth, which is for young children with autism, and he's meeting with other young people who've got the same thing. So it's normalising it for him. So he's talking about it. He's talking about how it makes him feel, and that's really important. I, a few years ago, would have found it very, very difficult to admit my social anxiety. But now, I can say to people, I'd like to do that, but actually I don't think I can. Or I can today, but on another day I might not be able to, because it depends on what goes on.
And your employers are mindful then?
No.
Okay. And that's the NHS?
Yes.
There lies the problem.
Yes, I've just been dismissed from my job for ill health. Because of my mental health.
Ellen, when you hear it,
I'm sorry.
You want to talk about stigma, there you go. Have things improved in the last 10 years? It seems probably not.
I've been off sick for a long time, and I have to accept there comes a point where I have to make a decision. Am I going to go back to work, or do I need to continue to make myself better? And right now I need to make myself better. So it was an agreement with my employer, but it wasn't really what I wanted to happen. But But I think you're right, it's about the communication, it's about being able to have that conversation, it's about to be able to say, actually it's okay, we don't all want to go to a party, we don't all want to be in a big group, actually it's okay to want to sit in the corner and read a book. It's okay that actually this office space today is too much for me and too noisy, and actually I just want to go and have a quiet lunch on my own. I'm not being antisocial, I'm not being rude, I need that downtime for me. And those are the conversations we need to be having in public to make that social anxiety at work and all everywhere more acceptable.
And I think and we've thought about this a bit when we've been talking to people on the phone-ins as well. It's actually the early intervention that helps. So by having those conversations sooner, people can hopefully make those adjustments, find out what works for them, agree, come to consensus about what the right plan is, whether some time off is a good thing to do now rather than waiting until things are worse. And for some people that can be sufficient to be able to recover in good time and not to be getting to the point of long periods of time of absence. So,
I wonder if we're at a point where if we don't show a bit more humanity and a bit more compassion, a bit more understanding, we're going to lose our jobs to computers. And so maybe we're in a world at the moment where more people are prepared to talk about themselves and admit their frailties, admit their humanity. Because without that, we're probably scuppered. So from some kind of perverse way, I'm tempted to say that hopefully our mutual understanding of this phenomenon will become more of tomorrow's platform. We will be in a much better place where we can feel more confident to share these elements of ourselves and perhaps have it provided for. I think we're doing really good job. For years we've done a really good job of inviting people in and say, tell us your story, and they open up and then there's nowhere to go. So I'm hoping that this technological revolution will see us as a much more humane, much more compassionate, much more understanding society. So all power to everybody on that. I'm sorry.
Yes, and the other part of this to me is, especially in workplaces, someone can say, oh gosh, I had man flu this weekend, it was the worst, and we're quite happy to talk about our physical health. Oh, I fell off my bike and broke my face. I don't know. Whatever it is about physical health, we're happy to talk about it for the most part until we start talking about sex. And that's my other remit.
No, they'll talk to me about that all there as well, don't worry.
But when it comes to our mental health, we can't speak that way yet, can we? And there's that really big barrier in workplaces where we're not quite ready to have that conversation. And I think it's really important, especially when you've got teams of people working together. So has anyone ever done in their workplace those personality tests?
Yes.
Right? Yeah, they're really fun. I did the color one, I'm red, which apparently means I'm super scary. I think it just means I'm American. But we're happy to do those types of things. Why can't we be happy to learn other things about our coworkers? Because we think it makes us look vulnerable to other people. And we're not quite there yet. The conversations are starting to happen, and we're starting to normalize what mental health and well-being is. But the other thing is, when we have man flu or we fell off our bike and broke our arm, we get better from those things. And actually, the majority of people who have mental health hiccups get better from those things. It's not going to be forever. For some people it will be, but they can still live healthy lives. So just admitting that you're having a struggle doesn't mean it's going to be forever, and it shouldn't mean that we're labelled forever. So those are just the kinds of conversations I feel like we need to have in the workplace.
And it would be wrong, Don, to suggest you're a mental health expert, but you must see people at their frailest in some respects.
Yeah, obviously we do in the Foodbank, but don't forget, we run Transformation CPR, runs a warehouse, right, where we can put operators in. For example, 17-year-old with autism, 4-to-1 care when he started. He's now down to 1-to-1, and we're discussing now that he'll come in on his own. Now that's taken 2 years, and he packs tea bags. He opens 240 boxes and puts 40 in a bag. He might do it for 10 minutes, he might do it for an hour and a half. We don't mind. We just want to care for him. Dal was saying about the police service. I remember the police service, start with me today. He cannot walk past his police station, and he hasn't been able to for 18 months. He started in the warehouse with me today. He came to me at the end of the day. He said, I never felt so tired. I didn't realise tins of beans were secondary. But he said, can I come back tomorrow? And that's the first step.
That's great. That's great. Has that been useful? I'm guessing you guys may have. And your support group, when did you start it and why?
We've just had our second birthday, and we started it because I started it because I had my own experiences of social anxiety. I got to the stage where I just overdosed, just didn't want to be here because I didn't think that I could fit in. I thought I was defective. I didn't really know it was social anxiety.
Right.
You just kind of think that there's something wrong with you.
Right.
So Quiet Connections is bringing people together. It's having those conversations, normalising that feeling of anxiety,
Right.
and just allowing people to be a little bit more
I think
self-compassionate towards them.
later on, Hannah may stick a microphone next to you and do a little piece for you so we can broadcast your story to a wider audience if you're up for that.
Yeah, we're up for that.
Let's
They
take
do
a
it through craft as well, don't they? You do lots of crafting activities.
Our
so
community
people
groups,
doing
yeah.
lots of
Great.
things and then talking alongside it, aren't they?
Yeah,
Brilliant,
yeah, it
brilliant.
serves as a nice
I'm learning
distraction to
something
get
all
them
the time,
talking.
thank you. Any other question before I go to another question here? Lady with the hand up, yep. Oh no, sit down, don't be silly. Just shout it so we can all hear.
Okay, my name is Chloe Milton, and I'm setting up an intergenerational community project. I work with people with mental health problems, from 5 to 80 or whatever. And I'm just wondering what you think about social prescribing and how would somebody like myself kind of approach you, or how would you approach me to help the people that you work with mental health problems?
Can you define social prescribing so we all are clear?
Social prescribing, so instead of automatically having antidepressants, is to prescribe something different, maybe like this organisation, maybe an organisation like mine, where people can come and work outside and setting up a hut. It's called the Hut and Field, and I want to do some gardening, woodworking, crafting, loads and loads of ideas, and mindfulness and meditation. So instead of having antidepressants, or any other kind of medication like that, is to come to people like us.
So why are you setting this up? Can I ask?
I've worked with people with mental health issues for 15, 20 years. But the reason I set up the intergenerational